Hello, my name is Angela Russ. This presentation is Stress and Time Management for Student Nurses. This is for Management 500 at Ball State University. The presentation today, I will go ahead and discuss our objectives. They are to learn what stress is and the physiological effects of stress, understand how stress affects the student nurse, discuss time management and the importance of routinization and prioritization, discuss how to apply these strategies to nursing students and nursing studies, and identify stress reduction methods. First, we will cover what stress is. Stress is the dynamic interaction between the individual and the environment. If a situation is perceived to surpass the individual's resources and skills, stress occurs. In the case where there's an imbalance, the interaction leads to cognitive, emotional, or behavioral alterations in order for that person to handle the situation. Examples of some of these alterations include insomnia, poor diet, anxiety, smoking, increased alcohol abuse, drug abuse, decreased physical activity. Next, we're going to talk about the physiological effects of stress on the body. These items include increased heart rate and respirations, headache, irritability, lack of energy, upset stomach. Stress puts the body into the fight or flight mode. During stress, the hormones adrenaline and cortisol are released. These hormones fuel the fight or flight response. If an individual is under stress for long periods of time or frequently, it can contribute to physical and emotional problems. Stress also increases the risk for coronary artery disease, type 2 diabetes, GI issues, depression, insomnia, and impaired immunity. They did a study on women in healthcare over a 10-year period, and it showed that women in healthcare in high-stress jobs where they had little autonomy were 67% more likely to have a heart attack than women in less intense jobs. There is also growing evidence on stress among nurses and nursing students and its effect on their well-being. Some items that are displayed include emotional exhaustion, lower back pain, once again, coronary artery disease, and mental disorders. Nursing students face not only academic stressors that a normal college student would face, but they also have an additional stress related to clinical experiences. Stress from clinical experiences can come from working with dying patients, insecurities about their competence or their perceived lack of practical skills, interpersonal problems when relating to patients. In addition, there is stress related to boards and initial placement after graduation. Nursing students also have increased workloads, longer hours of study, and potentially less free time. Nursing students have readings, coursework, quizzes, labs, clinical hours, care plans, and other work that can be very labor intensive, and it limits the amount of time that students have for relaxation, fun, and extracurricular activities. Two strategies have been identified to help practicing nurses with time management. These can also be applied to student nurses. In a study performed by Waterworth, nurses in 5 different healthcare organizations in the UK and a variety of different clinical areas were interviewed regarding how they organize and manage their time. It was determined that nurses use a wide variety of time management strategies, but Waterworth decided to focus her findings on 2 of these strategies, routinization and prioritization. Routinization is a routine. It provides a form of time supervision. It sets expectations. It can help decrease thinking time, reduce time pressures, provide a sense of predictability and familiarity. Routines, they can help provide a sense of order, and they are habituated ways of responding to occurrences in everyday life. It's important to understand routines because they demonstrate actions that have previously been worked out to maintain order. Routines are important because they not only comprise a sequence of activities or tasks that need to be completed, but they give you a duration for the activities and a speed at which they are to be carried out. The second strategy is prioritization. The ability to prioritize is a prerequisite for effective work performance. We assume that priorities can be determined. The nurse can make decisions based on what is most important, and then the nursing actions can be made based on these decisions. Prioritization, it provides a structure for the order of work. It becomes an integral part of a nurse's routine. And lastly, prioritization is complex and it can be subjective. Priorities can vary from one nurse to another. To start out applying these strategies, the first recommendation is to write out your short-term and long-term assignments or goals. This can include your daily assignments, quizzes, midterms, finals, anything that you have due soon or in the future. Next, determine reasonable amounts of time required to complete these tasks. This may take practice, but it will allow you to adequately give yourself enough time to complete the assignments. Next, prioritize based on your personal strengths and weaknesses. This allows the nursing student to individualize the process. They can focus on areas that need more attention. For example, if you excel at writing nursing plans, but you struggle with exams, exam studying should take precedence over care plans in order to better comprehend the material. Finally, create a study routine and put it in writing. This allows you to visualize your plan of action and it can increase accountability. Next here you'll see a study plan that I have put together. Each day of the week there is a allotted time for studies. For myself, I put readings at the beginning of the week. I prioritized readings as number one because I personally tend to struggle with getting the reading done ahead of time. I always seem to put it off to last minute. So I placed this first for my study plan. Then I continued with the rest of my week's assignments. I put time for exam studying, group projects, care plans. Lastly, I put online work at the end. I prioritize this at the end of the week because I figured or assumed that if I completed my readings, my exams, done my care plans, and my study projects or group projects, I should have all the preparation needed to put online postings for discussion boards or assignments of that sort. This is just an example here, but it gives you an idea of creating a study routine and then prioritizing in order to make the routine more beneficial to you. Lastly, I wanted to touch on stress reduction methods that can help manage stress. Meditation, exercise, healthy diet, massage, extracurricular activities. Meditation allows you to focus on your breathing and become more aware of the present. Exercise releases endorphins, which counteract adrenaline's negative effects. And people who get regular exercise have lower levels of stress hormones and experience smaller increases in heart rate and blood pressure during stressful times. Lastly, if you feel that your stress is unmanageable or you're having difficulty handling it, seek a mental health professional. Face-to-face counseling with a mental health professional can help you handle stress before it leads to a larger problem. Finally, we'll go ahead and summarize what we've gone over. Prolonged stress can be harmful. Nursing students are especially susceptible to stress due to many variables. Two strategies that we identified today are routinization and prioritization. They can help with time management for nursing students. And lastly, manage stress through additional stress reduction techniques. Thank you very much for your time.